What part of this looks good? None of it? Hi, and welcome to Health Effects. I'm your host, Nicole Tay, and today's topic is Trump's healthcare reform plan. Donald Trump was announced president-elect of the United States. Political affiliations aside, let's look at what could happen to the American healthcare system and that precious little entity we call you. Today, I'm going to explain Trump's plan while answering a few questions about the ACA, Medicaid, pre-existing conditions, costs,
Hey, what about the Hamilton boycott? What about Kanye for Trump? And what about those Starbucks cups?
You know what, anonymous voice? It's really starting to sound like you're trying to distract me from the real issues at hand or something.
No shade, no tea. I'm just letting you know.
Trump wants to either repeal and replace or amend the ACA. The ACA, or Obamacare, is a health insurance program offered or insured by the federal government. Trump and Republicans really dislike the program's individual mandate, which says that citizens should buy insurance or be penalized. Not just to slap the little guy around, but to actually ensure people have insurance and that they aren't going to suddenly buy it after eating a dozen pot brownies and realizing they can't get home from the 10th dimension. Where am I? Trump argues that repealing the ACA will increase individual control. Then you decide if you want health insurance and how you will pay for it. There are parts of the ACA that Trump and certain states like. So if Trump repeals the ACA, states will have a decision. Either provide their own public options if they can afford it, or rely on private insurance. Currently, you can only buy insurance in a state you are a resident. Trump wants to allow the sale of health insurance across state lines. So hypothetically, you could buy Mass Health from anywhere in the country, not just Massachusetts. Trump hopes this will lower costs by increasing competition and consumer choice. States already anticipate issues with this. Every insurance plan has its own unique provider network, protocols, and prices based on state data. Adapting a plan for one state to fit insurance holders in another state will be difficult. And when companies can attract customers from across state lines, companies generally relocate to a state where the courts give them the most protection. That's why all the credit card companies are in Delaware. No, it's not just because of blue crab and dogfish head beer. This could be a win for private insurance companies, but a huge loss for states' rights and regulation. Ultimately, each state will have to decide what to do next, and what role, if any, it wants to play in providing healthcare. If you're on the ACA now, like 20 million other Americans, your state may just offer a new ACA-like option. You could also end up having to insurance shop again, but this time using money from a health savings account or an HSA. You'll only benefit from an HSA if you can afford to put money in it. After all, a second savings account for healthcare isn't going to happen if you don't have money to put into your actual savings account. It's kind of like being told there's a sale on Lamborghini polish. Unless I own a Lamborghini, the fuck am I doing with this polish? Medicaid is a federal program that provides support for low-income Americans living below 133% of the federal poverty line. The federal government gives Medicaid subsidies to the states and pays for a percentage of the state's Medicaid costs for the year. The states decide how to use that money. Under Trump's plan, Medicaid would be a block grant program. It's like getting one big allowance from your parents once a year. Except, what if that year you break your leg and the new class bully, let's call him Fraud, happens to take your lunch money every day? That fixed amount from your parents isn't enough, so maybe you just don't eat lunch for the next 8 months? As the parent, do you A, beat up the punk bully, B, give your kid more money, or C, let your kid starve? Don't worry, there's always next year. If you qualify for Medicaid now, your coverage may change depending on how your state votes to allocate money. The Trump administration may be expanding Medicaid. This would hopefully widen the Medicaid safety net and extend coverage to people previously in the donut hole of healthcare, income too high for Medicaid, but too low to buy insurance. For example, say you're Zach, a single dad of one working 2 part-time jobs. You earn $26,000 a year before taxes. Therefore, you're earning too much to qualify for Medicaid, but you're not earning enough to put anything into an HSA and buy insurance. If you don't qualify for Medicaid, you'll have to purchase a really comprehensive health insurance plan. To health insurance companies, you'll be about as welcome as cholera in the drinking water because you will cost them more money. Private insurance companies either won't cover you, only give you catastrophic care, or make you pay a ridiculously high premium. Under the ACA, no one can be denied coverage for a pre-existing condition. Plus, the ACA also set a standard for minimum coverage. Trump promised to protect people with pre-existing conditions, so he needs to find a way to prevent discrimination if he's going to repeal the ACA. When you go to the hospital, you don't give a shit what the bill is as long as insurance covers it and you just pay the copay. Yeah, you get slammed with the bill later, but as long as you have insurance, it's all good. It's like when you're out at dinner with your parents. I'll have the Kobe filet mignon, but when you gotta pay the bill, Trump wants to show you prices before the procedure. So essentially, you could sit down with your doctor with a menu of options, shop around, and compare prices at other hospitals. But would prices drop enough for Americans like Zach such that being uninsured is even possible? Maybe he can cover that MRI for $2,600, but he's praying he doesn't need anything more serious like a heart stent. You could also see the costs and decide you don't want treatment at all.
You're bleeding.
I bleed every month. Plus, I don't need you telling me what kind of care I need, okay? Plus, medicine is inherently unpredictable. If you need an ambulance or an emergency surgery, you're probably not going to be looking up prices during your heart attack. But I don't know your life. Overall, if you're employed full-time or are above the lower middle class, probably not much is going to change for you. In fact, you might even find yourself with more options for your care. But the big question goes back to our single dad in the lower middle class. Will Trump's measures drive costs down enough so that he can afford insurance? And/or will Medicaid be expanded enough? Will prices drop at all, or might they actually increase since companies are able to form state line crossing monopolies? Here's the bottom line. State and local governments are going to decide the healthcare changes that will affect your daily life. Even if Trump repeals the ACA, he's ultimately handing the healthcare decisions to the states. He's basically saying, I did what I promised, it's your job now.
Good luck, and don't fuck it up.
Vote in your local and state elections because that is where it's going to matter.